pump with the bands. Pump with the pump with the put the pump with the bands. Pump with the pump with the pump with the bands. Pump with the bands. Pump with the bands.
Have you ever wondered how a hospital can win a quality award? Not once, but twice.
So today we are going to talk about North Mississippi Health Services, also known as NHMS,
And how it received its second Merit Award.
But don't worry, this is not just about America. We will also see how Malaysian public hospital and clinic are doing the similar things.
So let's break it down together.
what was actually NHMS focusing on when they received this second award?
The answer is simple: building a culture of performance excellence across the entire organization. This means NHMS didn't just focus on doctors or top management. Instead, everyone mattered, from nurses and frontline staff to administrators and leaders. They focus on strong leadership, clear strategy, empower employees, patient-centered care, and continuous improvement using data. In short, quality was not a department, it was a way of life.
Now, let's talk about why this focus was so important. Healthcare is not selling clothes or food. One small mistake can affect human life. And HMS realized that good technology alone is not enough. Rules without teamwork don't work. And quality must be built into daily work. By focusing on people, leadership, and system, NHMS was able to improve patient safety, increase staff certification, reduce errors and inefficiency, and achieve a long-term organizational success. Really exactly what the Malcolm Bridge model is all about, not short-term success, but sustainable excellence.
First criteria is leadership. NHMS leader didn't just sit in the offices making decisions. They actively communicated mission, values, and set clear quality goals, and also supported staff improvement ideas. In broad-range terms, leadership sets the direction and culture of the organization.
So the next criteria is strategic planning, which is NHMS used to 5 critical success such as people, service, quality, finance, and growth to guide their plans. This means every department knew what their goals were, how their work supported by the organization, and how success would be measured. So no confusion and no guessing, everything was aligned.
Third, customer focus, or in this case, patients. NHMS created a patient-focused improvement department. This team looked at patient feedback, service experience, safety and care outcomes. Instead of asking, is this easy for us? They asked, is this good for the patient?
So next is measurement, analysis, and knowledge management. Now, here comes to the data part. But don't worry, it's not scary, which is NHMS used KPIs, performance dashboard, quality indicators. Data help them answer questions like, are we improving? Where are the problems? What needs to change? In Broadridge, you don't improve what you don't measure.
Next, process management. NHMS didn't run separate quality program everywhere. Instead, they integrated all quality initiatives, standardized processes, reduced duplication and waste. So everything worked together like a well-oiled machine. Finally, the results. Because everything was aligned, NHMS achieved, first, strong workforce results. Second, high-quality patient care. And the third one is good financial performance. And that's why they earned their second Merit Award.
Okay, now that we have seen how NHMS applied the Belgian criteria in the US, the big question is,
Can the same criteria work in Malaysia's public hospital and polyclinics? The answer is yes, and in fact, Malaysia is already doing many of these things just using different names.
The Barrage criteria are highly applicable to Malaysian public healthcare because Malaysia already use similar quality framework such as
ISO 9001-2015, Patient Certification Service, Hospital Accreditation System, Continuous Improvement programs, and so budgets is not something that completely new. It's actually more like connecting the dots.
Now, let's start with leadership. Under the Barrage criteria, leadership means top management actively guiding quality performance, not only just giving orders. In Malaysian public hospital, hospital directors play a key leadership role. They chair quality assurance committees, and they also monitor hospital KPIs and service performance. For example, in MOH hospitals, quality assurance committees led by hospital directors regularly review patient safety issues, service delays, performance indicators. This shows that leadership in Malaysia already reflects Barrage leadership principle.
Next, strategic planning. Budgets require organizational to plan for the future based on the clear goals and national priorities. For example, in Malaysia Health Sector Transformation Plan, HSTP Hospital align its service expansion, resource allocations, facility upgrades. This is exactly what Budget means by aligning strategy with the performance excellence.
Now, let's talk about customer focus, or in healthcare, we call it patient. Barrage emphasizes listening to customers and improving services based on feedback. In Malaysia, klinik kesihatan and hospitals use Patient Satisfaction Index (PSI) surveys. For example, klinik kesihatan collects patient feedbacks to reduce waiting time, improve counter services, and enhance communication with patients. This shows that Malaysian public healthcare already applies patient-centered principles just like Barrage.
Now come one of the most important budget criteria, measurement and analysis. Budgets believe that decision should be based on data, not assumption. In Malaysia, public hospital like Hospital Information System (HIS) are widely used. Key performance indicators are monitored regularly. This data actually helps the hospital identify problems and take the corrective actions, which is exactly what budget promotes.
So, let's talk about human resource focus, which also known as workforce engagement. Barrage emphasizes that employees must be competent, motivated, and supported. So, in Malaysia, doctors and nurses must complete CPD, which is Continuous Professional Development. Competency-based training is mandatory, and the doctors must comply with MOH and professional board standards, which this ensures a skilled and committed workforce, which a core Barrage principle.
So let's move on to process management, which is the budget's focus on the managing work process efficiency and consistency. In Malaysian public healthcare, standard operating procedure (SOP) are widely used in the clinical pathway guide to guide the patient's treatment, and standard treatment guidelines are ensure the consistent care. This actually shows a strong alignment with the budget process management and criteria.
So, finally, Liana, we have business results, which in healthcare means outcomes, not profit. So, in Malaysian public hospitals and clinic, results include reduced outpatient waiting times, improved patient safety, and better service efficiency. So, these outcomes demonstrate how Barrage style practices lead to real and measurable improvements.
To wrap it up, NHMS succeeded because they focus on people, use data wisely, align leadership, strategy and processes. The Baldrige model which we learned in topic 9 is not just theory, it works in real life. And Malaysia's public healthcare system already applies many of these ideas. With stronger integration, it can achieve even greater excellence. So you guys, thank you for watching!